I'm Tonya Shea. I'm a physician at Lake Cumberland Medical Associates. I completed my residency in family medicine here at Lake Cumberland Regional Hospital, and I graduated in 2018.
My name is Matt Shea. I'm a physician. I completed residency here at Lake Cumberland Regional Hospital in internal medicine, and then went on to do 2 additional years of training in nephrology at the University of Kentucky. So I chose internal medicine mainly for leaving opportunities beyond residency if I wanted to pursue something further. When I started residency, I thought I wanted to become a hospitalist, but there was thoughts that I might want to pursue something further. So after doing rotations in internal medicine as a student, I really felt that was what fit me best and decided to pursue internal medicine.
I chose family medicine because I like to take care of pediatrics, young adults, older adults, inpatient, outpatient medicine, nursing home care, and so it really encompasses all aspects of that.
While doing internal medicine residency at a smaller community hospital certainly can present its challenges if you're wanting to pursue further subspecialty training. I think it prepared me very well and gave me many opportunities that I could pursue, especially in nephrology, really anywhere I wanted to. I think the level of training that I got here, both from an academic as well as procedural standpoint, made me very well prepared and very on par to residents that would have trained at a larger academic center for residency.
After completing 3 years of family medicine residency here at Lake Cumberland, I felt more than prepared to be a competent attending physician, and I wanted to give back to the program what they had given me and teach residents going forward in the program how to be a well-rounded family physician, both in the hospital setting, the clinic setting, and in the nursing home, and just being part of the community. My purpose in teaching is to make sure the resident is a well-rounded family physician that can take care of all ages, from birth all the way through adulthood to end-of-life care, with enough autonomy that they learn and can be proficient, but to also know their attending is behind them and will support them and not let them fail, and the patients will be taken care of in that process.
Throughout residency, you really learn to be a physician. And with that, you really need good educators and clinicians in the hospital and the clinic, guiding you through that process, but also giving you enough autonomy to make decisions on your own and ultimately be able to take that information with you when you practice independently. Completing fellowship at a large academic center, the teaching is a little bit different there, meaning that all the subspecialties have fellowships, and the main learning is from the fellows and other residents. Here in the smaller community setting, a lot of that subspecialty education is done by the attending physicians themselves, and it's a really good chance to work one-on-one with those attendings, gaining their knowledge and experience that they've gained over time.
We got married at the beginning of our 4th year of medical school and then moved here for our residencies. We had a daughter our 3rd year of residency, and then she's now 2.5 years old. After residency, I joined the core faculty for our family medicine program, while Matt did his fellowship training in nephrology at the University of Kentucky.
Work-life balance as a resident, as well as being married with a family and a new child, was certainly challenging at times. There's a lot of support in the community from faculty advisors, support staff at the hospital and the residency program. And while you're working a lot of hours, they certainly made it easier for us to handle all of those things outside of work as well. So after residency, when we were trying to decide where I should pursue fellowship at, we ultimately chose staying in Somerset, and with me commuting to my fellowship in Lexington. We had already established a lot of support here in Somerset. Tonya had moved on to and is attending, working in the family medicine clinic and working with residents. We had already established childcare here, so it just made sense for us to stay in Somerset and me commute for those 2 years. While it was hard, we certainly got through it. It presented its challenges at times, but wouldn't change it for anything, and there's certainly support here in the Somerset area if it's needed.
As a female physician here, it's challenging for anyone to have a small child, but the program supported me in that from, I would say, even both of us actually from day one. And if I needed to leave to go get childcare or make that arrangement, they would work with me on that. And then even as an attending, the other attendings fully supported if I needed to go pick her up from daycare, or if she got sick in the middle of clinic and I needed to go take care of her. They were all completely understanding and would help out in those situations.
If we had to do it again, we would definitely recommend the residency programs at Lake Cumberland Regional Hospital to anyone that asked us about it. We did it as a couple. They were very supportive of us doing it together, and we would highly recommend it to anyone.